Candidiasis is a fungal or yeast infection affecting usually the mucous membranes of the oral cavity, the throat, the vagina, and very rarely and in extreme cases as invasive candidiasis that affects other organs and other systems. The candida is a natural fungi that lives in the mouth, the belly, the vagina, and on the skin. There are so many species of the Candida genus, but then the most common one that causes the candidiasis infection is the Candida albicans. Candidiasis infection is so common that approximately every 3 out of 4 women that is selected will have an infection of Candida once in their lifetime. But then it is a misconception that candidiasis only affects the vagina. Rather, other types of candidiasis are there, such as the oral thrush or oropharyngeal candidiasis, the invasive candidiasis that results when the Candida genus or the Candida organism migrates out of its surrounding and then enter the bloodstream, causing major and serious infections in other organs. But for today, let's focus our studies on the genital yeast infection or the common vaginal candidiasis that we all know of. The Candida organism isn't generally that bad, he's not a villain. But then even their presence ensures a homeostatic environment wherever that they are supposed to be actually. That is, when they are in the mouth, in the oral cavity, the activities there ensures balance. The same way when they are in the vagina, the activities also ensure a balanced homeostatic environment in the vagina. And so it is not right, or you should not seek to destroy or do away with all candida in your vagina. Rather, occasionally, certain activities and certain things that we do or that occur to us may cause an imbalance in the body's control mechanisms. When this imbalance occurs, then we end up having an overgrowth of the Candida organism. Factors that may cause or that may bring about an overgrowth in the Candida albicans leading to candidiasis include pregnancy, diabetes, and then some medications such as birth control pills and antibiotics can also lead to an overgrowth of Candida. And then douches and vaginal sprays, spermicides, all these can also cause an overgrowth of Candida. And then immunosuppression, that is when your immune system is suppressed or is down, you can also get an overgrowth of Candida organisms. And then when you wear tight underwears or when you wear wet clothing for a long time, they make the environment conducive for an overgrowth of Candida. And then occasionally you can also contract it through sexual intercourse. The symptoms of candidiasis can be very similar to symptoms of other vaginal disorders or infections. And so how can you distinguish your candidiasis from other vaginal infections? Usually candidiasis, its main distinguishing feature is the presence of a thick white cottage cheese discharge. That is the main difference that characterizes candidiasis from the others. But then you can also have extreme itchiness in the vagina. You can have redness and swelling of the vagina and the vulva. And then you can also have painful urination, very painful ones. You can also end up with having discomfort during sex. Occasionally, some ladies complain of having odor in their genital area. So how can you treat your candidiasis, or how can you deal with your candidiasis? It is best that you report to the nearest health center or to your physician so that he can ascertain that it is actually candidiasis, since it can be similar to other vaginal infections. And then if your candidiasis is recurrent, that is a chronic candidiasis, he's going to put you on a medication for some time. He's going to put you on medication. But if yours is the usual normal candidiasis that comes, you usually just need some hygienic changes. You have to take care of your body well. You have to eat well, that is to boost your immune system. But then if you need medications, you can treat candidiasis with over-the-counter medications such as the fluconazole, the clotrimazole, the nystatin, and other antimicrobials or other yeast infection medications. Preventing candidiasis goes with taking care of yourself. That is basically it. Your hygiene is very important. Make sure you change your panties usually, especially during your menstrual cycle. You make sure that you bath your place well. You make sure that you avoid douching and using vaginal sprays, spermicides, and all the such medications. And then you should also ensure that your underwears are not too tight to restrict airflow, but then should be spacious enough to allow gaseous exchange. And then do not wear wet undergarments for a long time. Pregnancy can predispose you, so when you are pregnant, always be mindful. When you're on antibiotics usually will suppress the bacterial activity over there. That's the very good bacteria that works there to ensure a homeostatic environment. So when you're on antibiotics, always ensure that you're going to take extra care of yourself so that the candida will not overgrow in the absence of the bacteria. If your candidiasis is recurrent, then you might need to have a health screening with your sexual partner to ensure that your partner is not the one that is giving it to you continually. Untreated candidiasis can be very, very harmful. One of the major complications is an invasive candidiasis whereby the candida fungi will migrate out of where the local infection sites and then spread into other organs, that is through the bloodstream, causing major organ damage and eventually death. Candidiasis is curable. Always seek early treatment and then ensure that you take good care of yourself to prevent its recurrence and other complications.